Hey, good afternoon. My name is Cara, and I am one of the pharmacists here at Hawthorne Pharmacy in Lugoff. And today for We Care Wednesday, I want to talk with you guys a little bit about ticks. It is starting to warm up, and we are all trying to get outside, whether we're just going on walks or going camping, enjoying the outdoors in many different ways. One of the things that we need to be aware of is ticks. So today we're going to talk a little bit about how to prevent getting tick bites, both before and after you go outdoors, what to do if you do have a tick that has bitten and attached on, and then some things to look out for tick-borne illnesses, and when you need to seek a doctor's help if you have been bitten by a tick. So it's a super exciting time now that we are in spring. It is starting to warm up, which is when, tick exposure is all year round, but they are most active during the warmer months, which for us is from about April to September. One of the best things that you can do is prevent tick exposure. So ticks are found in the tall grasses, grassy, bushy, wooded areas. So avoiding those super tall grassy areas when you're walking on trails, making sure to stay in the middle of the trail and not along the outskirts. Or if you do go out into those tall, grassy, bushy, wooded areas, knowing that you could be exposed to ticks. If you plan on going hiking in some tall, grassy, bushy, wooded areas or camping, one of the best things that you can do to prevent tick exposure is to treat your clothing and your gear with a 0.5% Permethrin Spray. This is available at most outdoor stores. It's something that you want to do in a well-ventilated area, so outside on your porch or on the grass, to spray down the clothing that you're going to use, tents, any of your gear, if you're planning on having some good exposure to high tick areas, so any of those tall grasses or wooded areas. The other thing we want you to do, and this is on shorter trips, so if you're going on a short hike or walking the dog around the neighborhood, things like that, make sure that you use an EPA registered insect repellent. So something that has something like DEET, PMD, or oil of lemon eucalyptus would be appropriate to use as an insect repellent to try and prevent tick exposure. That's before you go outdoors. Once you have gone outdoors and you've enjoyed being outside, you've gone camping or hiking, once you come inside, you want to make sure that you check all of your gear, your clothing, and your pets for signs of ticks. Within about 2 hours of coming back indoors, you want to make sure you have a good shower or a bath, and this is a really good time to check for ticks. That's the most important thing around this time of year, is if you're gonna go in these wooded areas and enjoy the outdoors, you wanna make sure that when you come back inside, you get a good shower, and during that shower, you check for ticks. So the places you wanna check, it's really head to toe. So you're gonna start up in the head and check the hairline as well as in the hair. You wanna check underneath your arms, in and around your ears, inside your belly button, on the back of the knees, between your legs, and around the waistband. Those are really the spots where you're most likely to get tick bites. If you happen to find a tick on yourself or a pet, if you've been bitten by a tick and the tick is latched on, it is really important that we remove the tick correctly. So there are some old folklore remedies out there that say that you should paint the tick with clear nail polish or cover it with Vaseline, and it suffocates it out and it will remove on its own. We want to avoid that, because the most important thing once you've noticed that you have a tick bite is to remove the tick as soon as possible. So we want to avoid any of the remedies that you may have heard where you wait it out and wait for the tick to remove itself. We want to go ahead and get some fine-tipped tweezers, get as close to the skin as possible, and pull with a upward, steady, even pressure motion to pull the tick straight out. Once you've done that, you want to make sure you clean the area with good soap and water or rubbing alcohol. If you're outdoors and you don't have soap and water, rubbing alcohol would be a great thing to carry along with you. So tick-borne illnesses are pretty rare. If you're bitten by a tick, that does not mean that you will absolutely get a tick-borne illnesses, but sometimes ticks can pass on bacteria, and we can be exposed to a tick-borne illness like Lyme disease or Rocky Mountain spotted fever. So some signs and symptoms to look out for if you've been bitten by a tick and you want to make sure to know when to go to the doctor is to look out for a few things. You might develop fever or chills. With Lyme disease specifically, you'll probably develop a headache, fatigue, muscle aches, and joint pain. Now this would be severe and not like a normal, if you've gone hiking, you might have some joint pain or some muscle aches. But if you notice an onset of severe muscle aches or joint pain, and you have also experienced a tick bite, then you may want to seek a doctor at that point and make sure that everything's okay. The other kind of hallmark symptom that you will see with tick-borne illnesses such as Lyme disease and Rocky Mountain spotted fever is a rash. Now they have two different rashes that you would see. With Lyme disease, the typical rash is what we call the bullseye rash. So it is a rash outline, and in the middle of it is clear skin, but the rash looks like a bullseye. That would be with Lyme disease. It typically presents within 3 to 30 days after the tick bite. Rocky Mountain spotted fever is a bacterial infection caused by a different type of tick, and that rash presents a little bit earlier, within 2 to 5 days after a tick bite, and it presents as small, pink, non-itchy spots, usually on the forearms, hands, or legs. So if you have a tick bite and you experience any of those symptoms, it would be wise to seek out a doctor and make sure everything's okay. Otherwise, just make sure you enjoy the great outdoors this spring and summer and do everything that you can to prevent being exposed to ticks. I hope this has helped today, and have a wonderful Wednesday. And as always, if you have any questions or problems, feel free to call the pharmacist here at Hawthorne Pharmacy. Thank you so much.